Hello, my Afrojamsnetworks people and viewers. Welcome back for another interesting episode for Chat with Doctor. Today, I get some interesting guests with me in the studio. Allow me briefly introduce yourself, then we'll come back to the conversation, which is very interesting today. The conversation, we're going to enjoy them. Dr. Do, introduce yourself with Afrojams viewers.
Thank you very much, Dr. Ernest. I'm glad for come back for Afrojams community for talk about the things and way they happen for our community. My name is Dr. Fidelis Doe. I be trained as an internal medical doctor and with subspecialty in hematology and oncology.
Okay, so Dr. Dodan say he specialized for internal medicine, then subspecialty. It means he specialized, then he specialized again. Now, plenty bookman for hematology and oncology. By the way, what to be hematology and oncology? What to be that subspecialty about?
I will keep them very simple because I don't want to complicate the definition. But hematology, na the study of blood and treatment of blood problems the way they for blood. Oncology, na the study of cancer and the treatment of cancer. So the diagnosis of cancer and the treatment of cancer.
Okay. So na here Dr. Do na doctor where they treat blood and cancer. Now where they call a hematology oncologist. Blood, hematology, oncology, cancer. So we're going to talk about plenty blood and cancer issues today. But before we get into that conversation on hematology and oncology and cancer, I want to ask you some quick questions.
Yes.
Now, the new theme, no man, no one old. All man, one young. In fact, not even an issue say no man, one old. All woman, them, primarily the one young. If you go for market now, you find ginger, you find turmeric, you find, in fact, they don't finish everything. Everything vegetable no day again. Mm-hmm. Everything fruits they no day again. Say na antioxidant. People they just jump all over the place, say antioxidant. What to be antioxidant? In fact, what more we start with oxidation? Oxidation a bad thing?
No, oxidation, depending on the degree of it, not be bad thing. And oxidation, I think, where it happen inside we body, and if it happen when we body the break down food or when we the breathe, when we the So oxidation, if you get the byproduct of that metabolism, those oxidative products, they call them reactive oxygen species or reactive nitrogen species. It is circulate for we blood. So depending on the amount, na good thing.
Give me one good example for what the oxidant.
It do. Oxidant, it help immune cells them for fight infection. Now, one very nice example of that.
Okay.
And then it help cells them also for their enzymatic process, the process where it happen for our body for break down things them and for produce enzymes.
Okay. So as another year, Dr. Doe say oxidant them, that oxidation a normal process where it happen inside our body. Oxidants them, radical oxygen species them, they help with body for fight infection too.
Correct.
Sometimes them,
yes,
right?
Yes.
So for people then for just jump all over the place, counter this, that, said antioxidant. I don't know whether at what point you feel recommend some people they take the antioxidant, because the oxidation a normal thing where they happen for our skin inside our body. So for preemptively one stop the oxidative process without any concern or regard for the fact that oxidation they help your body, no between ways people they're supposed to do routinely. Instances that the way antioxidant they be helpful, right?
Correct.
Give me example, doctor.
Well, oxidation take place inside our body naturally as we eat and all that, but we get oxidation where they happen due to pollutants, air things like smoking, like smoke for air and other chemicals, corrosive chemicals and all those things, then we would breathe them in. So those ones, them are external oxidants. Okay, so sometimes they be inside our body where those oxidants, them, because our body to get antioxidants,
good,
where they neutralize, because human body be very complex. So when we produce those oxidants like that, what we say it help. When you don't too much, we body to produce antioxidants by itself.
Good.
So it could neutralize them.
Good.
So now when the oxidants they don't be too much, we call and say now oxidative stress.
Okay.
Yeah. So sometimes it be where people they just jump say okay, we not measure them because it happen inside the body the oxidative stress. Okay, so if you just jump, say, okay, I go take vitamin C, I go take vitamin E, and strong antioxidants and that, where you don't know what it happen, you be healthy, you don't know what it happen inside your body, and not isn't the right thing for do.
Okay, so when I hear for doctor mouth, this may we not finish turmeric for market or may we not finish onion, ginger, garlic, everything. It has to go off the market now. In fact, another way that for people to reach antioxidant, maybe tomorrow you start say antioxidant too. Just this one a joke.
Yeah.
But because you be cancer doctor, we also know say something that oxidative stress where they talk sometimes if it lead to cancer.
Cancer,
right?
If it lead to cancer, to heart disease, to diabetes, to chronic diseases.
Okay.
Yes.
All right. So we will come for that particular issue. And cancer. Maybe we start now as inside the topic. You don't say you be doctor where you deal with blood and cancer.
Correct.
Maybe we start with that blood first, then we will go to cancer, right?
Yes.
Some disease. And by the way, Dr. Dona, Dr. Way, we briefly introduce some other, you do with this what they call Western medicine, conventional allopathic medicine.
Yes.
But you add some other thing again for your specialty, your subspecialty. Now, which one that?
Yeah, that is holistic medicine.
What is holistic medicine?
Holistic medicine, that is you come, we did try to find out the root cause of your problems so that when we get into that root cause, we fit treat them, we make sure say the problem not go happen again or it not go happen as often as it happen. Because for conventional medicine, you come with blood pressure, with diabetes, they prescribe you medicine, you go. Doctors, they take the time for say, why this man get this problem? So we get to ask more questions for go into the root cause of the problem for holistic medicine.
Okay, great. So we will come now, my people, wherever we sit, una not go for lunch, una not go for breakfast, una not take break. Una just sit down for chair, squarely watch this show and see and listen for everything where Dr. Dodi talk. Because there are very interesting topics in this. This blood and cancer issues them. They're plenty inside our society. So I just want to make una call una friend them over the phone. Tell them, say, wherever they made a tune to this particular program. In fact, if we not get access to one of these smartphones, we're not so there for every social media platform, TikTok, YouTube, Facebook, Instagram, X. We're there for all those one them. So when I share, call them, when I tell them, say, take time, start watch this particular program. I want to ask you some particular blood issue where it be common inside our society. They call it sickle cell.
Okay.
What to be sickle cell, Dr. Do?
Well, sickle cell, they call them sickle cell disease, sickle cell anemia, they interchange those terms. But sickle cell disease, now disease where it common for we community, and what did it happen? I say, now disease where it affect hemoglobin. Hemoglobin, now the cell inside with blood, where it transport oxygen from the lungs to tissues in our body. So hemoglobin be made up of, you get one gene from your mother and one gene from your father. Okay, so when you get a problem for one of those genes, you get what they call, say, you be carrier.
Okay.
Now, if you get problem, if you inherit the gene, the abnormal gene from your mommy and you inherit the abnormal gene from your papa, then you get what they call the disease itself, where now hemoglobin SS.
Okay.
Yes.
So SS, small, and SS, big, or big and small. So you talk this one, say carrier, and the person with that full person will get sickle cell disease. Any difference there between them two?
Well, yes, difference there. People the way they are just carrier, their blood they function normally unless they get into a very stressful situation like mountain climbing or a lot of exercise where the oxygen tension inside their body low. Then they feel sickle small, but they're not go sick like the person will get sickle cell disease.
Okay. So you don't use some term sickle.
Yes.
We go come and explain what is sickling mean. But you don't tell when I say person where not only career for sickle cell trait. Not be normal, not be a given, say, he go get all this, which Dr. Dogo can talk about the signs, the symptoms, and for that issue. If it happen on certain situations, if you go for places, oxygen short, oxygen no plenty, then you first start get problem. So now just another way for tell with people and say, if we not say we be carrier for this sickle cell, we avoid some kind of situations where it will require oxygen, where either oxygen short or when I there for some places it be they call it rarefied air, height, climb for mountain, oxygen not plenty for day.
Yes.
Okay. How about the sickle cell patient then, the direct one? What should be their problem?
Well, the sickle cell patients, then we just need for the oxygen for drop small in any situation or the exercise and all that. Then their problem, I say the cells, those hemoglobin cells, that hemoglobin SS. Normal hemoglobin na round, pliable, na soft. That is, it flow normally for your body, supply oxygen for place every organ for your body. Now the hemoglobin SS, it be shaped. That sickle means it be like banana. It be like banana shaped. Then it be hard. It be sticky. So, the flow through your bloodstream the way it's supposed to flow. So it will block some areas them, and then oxygen not go feel reach the tissues or the organs. So it cause problems.
Okay. So Dr. Dodan say blood stream. For with the column for Pidgin say vein. Normally, we no one make the difference between arteries and vein. Yeah, blood vein, right?
Yes, correct.
Yeah, vein.
Correct. Yes.
And that's what we call them now.
Yeah.
Vein. The blood, because it don't be sick or it don't change shape. It not go fit pass inside your vein fine.
Smoothly.
Then what did it happen at that point?
What did it happen at that point? I say, go get oxygen delivered to the organ where it's supposed to go to. Then those cells, they feel be destroyed very easily. Normally, a red blood cell, the normal one, they live inside our body for about 90 to 120 days. This one, they live not only for like 10 to 20 days. So it go die, because of that sickle cell structure, where it go make it die very early. So it go die producing what we call hemolytic anemia.
Okay. Did they cure sickle cell disease?
Right as of now, cure no day, but scientists, they work very, very hard for cure sickle cell disease. They do what they call gene therapy.
Okay.
And if you do bone marrow transplant.
Okay.
Yeah, actually, one case there in New York where they do bone marrow transplant for a 21-year-old young man where it come up successful. But now very, very expensive procedures, and that will not be all man fear for them.
Okay. So, but did you treat them?
Did you treat them very well?
So what's the difference there between cure and treat?
Well, treatment, you come with condition, with disease, where if we give you medicine or we do surgery or we do this, you go on a problem where it never completely disappear.
Okay.
So nothing where if you come back, So example, na high blood pressure, na diabetes, we prescribe medication, you go, you take the medicine and all that. For one reason or the other, it not be controlled. You come back for your doctor, you get to see your doctor all the time. Cure, nothing. Now when you come with some problems, and then they give you treatment, you're not going to ever get that problem again. They don't cure you.
Okay. All right. So treatment, they're different from cure. So how will they treat, now we will say cure, no, how you treat person where you come with sickle cell anemia? How you did treat it?
Well, as things that they cause, what they call, say, sickle cell crisis.
Okay.
Where if he been, say, because that low oxygen tension don't happen or the person don't over-exercise or whatever the environment be, those cells, they sickle, if it be dehydration. So when the person come, we make sure, say, they be hydrated, you give them enough fluid so that if you go inside, that vein them, it do. Then sometimes they come with what they call pain syndrome because as you don't block oxygen from going to those part of the body, if it be chest, if it be ankle, knee, anywhere, then the patient, they get a lot of pain. So we get to give them pain medication. Now, when they get something they call a chest syndrome, now when it don't really affect their chest, they know if you breathe fine, you get to give them oxygen. So basically, na symptomatic treatment. Okay. You treat the symptoms where they come with them.
Okay. So you talk about this pain and chest pain syndrome and all of that. So you treat the symptoms, which the person come with them, give it maybe hydration, maybe an infection, make it, or some other situation, make the person, those cells a sickle. Then now you go treat the pain and then give some little hydration.
Yes.
There's some interesting, I want me you tell with people that look inside that camera, tell with people that, interestingly, very some coincidence. Say, and this sickle cell flop for placing malaria plenty.
Yes.
Why? Some benefit there, something the way person with sickle cell and malaria, they get in common. Tell with people them.
So, what did it happen? I say, na generational thing. So, not be thing where it happen in 10 years older. So, place where people, the way they get sickle cell, you remember we talk about sickle cell trait.
Correct.
They get not only one gene and they feel live normally, you see, unless they get into very stressful situations. Now, people, the way they get the sickle cell disease, when they for place where malaria they, they feel easily, people that with sickle cell trait, they feel easily survive.
Okay.
They feel easily survive, so they go reproduce, but that's bring forth children and all that, and that process will go on. So now just a selection, natural selection.
All right. So Dr. Dodan said talk something. We go take some quick break, but it talks say sickle cell people them they survive malaria.
Sickle cell trait.
Sickle cell trait.
Yes. There's sickle cell in the when we don't get better treatment and all that, they die.
Okay.
Yes.
So sickle cell trait, it did like say they help people them may they survive malaria. It not mean say may mango get the trait now for free survive, but when we come back for this short break, you could explain to people them why people them when a sickle cell trait they survive malaria past me and you.
Correct.
We will take a quick break. We'll come back. Dr. Dogo explain that. All right, my people, then want to welcome back for this interesting topic for studio here, chat with doctor. Today we talk with Dr. Do, Fidelis Do inside studio about blood disease. We start with sickle cell, then we'll go to cancer. But before we want to take this short break, maybe they talk, say people then wait na career for sickle cell. It did like say that career status, they help them for prevent or for deal with malaria. Explain that one. Not true?
Not true. So what did it happen? I said the malarial parasite, if it develop very well inside normal red blood cell, where you get normal hemoglobin. Okay. Now for the sickle cell, enough fit develop inside well. First of all, malaria parasite need a cycle. It need for develop for stages inside the cell. But since sickle cell, they die quick. You see, so it could die with the malaria parasite. Okay. Now, one thing that. But then chemicals, they inside to where it make the malaria parasite not actually divide inside the cell for produce more malaria parasite. So all them go die.
Okay. Mm-hmm. So when I don't hear for authority on MOP, people then when a sickle cell career, they survive malaria pass, we, the normal people them. So it did like say, for some coincidence, nature, because say malaria plenty for we, sickle cell plenty for we countries and where we there, it just some kind natural phenomenon happen.
Yes.
Where it confers some level of immunity.
Correct.
It prevent people with sickle cell for feed suffer plenty malaria crisis. So na good thing. Some of na good talk say that one a God, but those of us we think differently. We go say this one na science.
Na science, correct. Okay. Yes.
All right.
Yes.
So now maybe we come for this other part of your. But before we want go for the cancer thing, right?
Yes.
I want to ask you some questions because we don't talk about this holistic care here. Yeah, approach where you give them for a patient where you come with sickle cell crisis.
Yes.
You don't use now the conventional approach. How about your holistic, where your holistic medicine hat? Tell me how you deal with person where it come, because I know for a fact that you get patient them, where the sickle cell patient them.
Yes.
How you deal with them holistically?
Well, holistically, we try for, we do so when you combine conventional medicine and holistic medicine, we go to the bottom of it, we call it integrative. So we integrate the two. So in this case of sickle cell disease, we mostly do the conventional medicine because the disease is then a serious disease and we will get to take care of. Now, we don't hear situations then where the people that they say that they use like pumpkin leaves and all those things, they will squeeze them, they will put them for the place where they hot and all that. So, those ones, of course, they'll not be available here. And we not, so we mainly go with the conventional part of things here.
Okay, all right. So, good. Now we will go to the other part of your specialization, your subspecialty.
Yes.
We're not cancer. But I want to make you look for that camera, you tell with people then, because some difference there, right?
Yes.
I want to make you explain for people then, between what they call neoplasm and cancer. Any difference there?
Neoplasm, as a name, the Greek term neo means a new, and plasm means a plasma or tissue. So neoplasm means new growth, new tissue, So, but if you get a growth or of a tissue where it really not been a cancer, they call them benign neoplasm. Okay. Then you get a growth where it be due to cells and where they divide, they not disturb, they invade other areas. That one malignant neoplasm.
Okay.
So malignant neoplasm are the cancer side, and then benign neoplasm are the one will not be cancer.
Okay. So tumor, not general growth, right?
Correct.
All right. So when the tumor that is will be malignant, where it is spread, now we call them cancer, right?
Yes, we call them cancer.
All
and
right.
when it don't spread, they say na metastasis.
Okay. So I be one way you explain this difference generally for people then, because one day they were in a benign thing as you talk, but not tumor.
Yes.
Then one day they were not be benign one, I wear the cancer. When you say cancer, not really as the serious one.
Yes.
Give example for some benign growth where it plenty for we country where it not necessarily means say the person there is on cancer danger.
We get skin mole. You know the way they swell for skin mole like that. You just come out. That one not be cancer, not just a growth.
Okay.
And then you get warts where it be for your finger. That one a growth. Not be cancer, be that one. Then for women, then fibroids. Okay, fibroid now another one where now the muscle for the uterus, for place where begin to stay, they just it grow, but not be cancer.
Okay.
Yeah, so now some examples in that.
Okay. I know say someone will be young because of several days, especially for people that stay for heights, where they not get plenty iodine or iodine.
Yes, that one, yes. So that one for thyroid.
Okay.
Yes.
Where they say goiter.
Goiter, exactly.
Okay. Not be cancer, no?
Goiter not necessarily be be cancer.
Okay, not necessarily.
Not be cancer.
Okay.
But if you get goiter, now just a swelling of your thyroid gland. Okay, so not be cancer.
Okay, all right. So if you get the swelling weight, not necessarily. In fact, the one when a cancer says we need to swell, you will see a weight already. We don't they don't already go for different side. So you say metastasis and non-metastasis. What do you mean metastasis? Now you start by saying metastasis. What do you mean that now, Dr. Doe?
Now me I say metastasis.
You said the metastasis. Say that metastasize.
Yes.
That's a big grammar.
Okay.
Explain that big grammar for people then here.
When cancer they grow for an organ, if it remain for that organ, it just be inside there. It not come out from that organ. It go another organ. So when cancer don't start come out there, it go for different side. It come out like for say you come out for your uterus, or it come out for your liver. It go for brain, or it go for lungs and all that. Now we say the cancer don't metastasize. It don't go for different area.
Okay.
So now it be metastasis. It don't leave place the original organ where it go outside that organ.
Okay. So we go one share with people that now say those of us who want to watch before we enter back into this metastasis issue, we check again for all with social media platforms them. YouTube, TikTok, Instagram, Facebook, X, we did it. Una follow we. Interesting topic. I go and ask Dr. Do now some interesting question. You talk about this metastasis. What man will get metastatic cancer? It means they don't fit cure am, or it depends?
It really depends, because some cancers, they will they not be too aggressive, even though if you go for another spot.
What do you mean by the cancer not be aggressive?
Cancer fit be way, even though it spread out of the original organ, it go a day around. But now one way, if you look at microscopically, you put them under microscope, not be the one way it be too aggressive. Means say it is spread very fast. It develop. It replicate. It divide very fast.
Okay.
Yeah. So sometimes if you catch them early, you take them out, you take the cancer out, and you take the small place where you don't go out, and then if you been a cure.
Give example for metastatic cancer will be curable.
Well, if you catch colon cancer early,
okay.
If you catch colon cancer early, where it still be localized for inside the colon, but it don't come out small, go like for a lymph node around the area, you cut that one, you take it out, that one if be cure.
Okay.
But if you leave and say make it spread, go for other places, then that one a distant metastasis.
Okay.
Now they problem they come out.
All right. Mm-hmm. The reason why I tell Dr. Dome explain, because sometimes they be what they call vox populi, just words around where people they talk for quartier, for neighborhood, say that person get metastasis for cancer. It means saying a death sentence. Oh, that person go die tomorrow. That person that already died. In fact, all this one them. In fact, so now I want me explain.
Correct. Yeah.
So yes, for say you get metastatic cancer, not mean as in a death sentence.
Death sentence. No.
So one the big curable, it depends on
the type.
Correct. And then
the extent.
Okay, and the extent. Mm-hmm. So now what comes for this particular thing, when you get patient, I know one more will talk about the allopathic, the conventional approach for person who get cancer. Mm-hmm. I want to make you use your theory heart. The heart for internist, internal medicine person. Mm-hmm. The heart for oncologist. And the heart for person who do holistic medicine. You get person where it come for you with cancer. Take them from there.
Okay, so cancer now, again, depending on the type, now a very serious disease. So not be think for go begin play with and say, okay, make I go take this herb, make I go take this antioxidant, make I go take this. If na cancer where it need treatment right there, when a different type of cancer, if it need surgery, meaning say they will take the cancer out. If it need radiation, meaning say they will point some special X-ray for play with the cancer there, or if you need chemotherapy, or immunotherapy. So all those treatment them, if depending on the cancer, we go once to make the get, because that one a proven treatment, given my conventional training, a proven treatment in that. Now, when you go for the holistic part, of course the person get to stay healthy. So the things that they feel help small. Those antioxidants what we talk help. They feel help small. Counseling of the patient because in a stressful situation, patients they be depressed. So holistic means you treat the whole person. So something that they call cognitive behavioral therapy.
Okay.
You
what do we cognitive behavioral therapy?
That means you explain the thing for the disease for the person, make it be used to that explanation, and then if he live with that explanation without worrying too much, because as we say, some cancers they not be deadly, they not missing a death sentence. Of course, then if you meet, and those ones that it be done by psychologists, mental health specialists, them, and then of course you get nursing, the way they do care for home and all that. So that holistic aspect of that, the help with the management of cancer.
Okay. Mm-hmm. So maybe we'll take a quick break. Because we'll come toward the end of the show. Maybe we'll take a quick break. When you come back, you go talk about this integrative approach for patients where you get cancer. Correct. Because it's a very interesting conversation. Mm-hmm. We need to do well for the community, not just radiation and surgery and all of that stuff. Mm-hmm. We go talk about the rest of this stuff when we come back. Correct. We'll take a quick break. We'll come back in 5 minutes. My people don't want to welcome back. I will say 5 minutes. Actually, it was 5 seconds. I don't want to go far. Actually, mean 5 seconds because the conversation be so interesting. Taking 5 minutes just to like, when go even play a game before I come back. But we go back to Dr. Do. Make he explain how you manage cancer because you start talk about this cognitive behavioral therapy and all of those things. Then some reason they were cancer patient go benefit for holistic care, and if so, why?
Well, despite all our efforts that we will do for treat the cancer, and again, it depends on the cancer. As we talk, some cancers, they be relatively curable when you just take them out, like testicular cancer for man. You know, you take them out, you sure say the person don't be cured. Okay, but the ones them way, for example, most say it gets small metastases, then they get radiation and then get chemotherapy. It bring a lot of depression. You know, so it bring a lot of depression. So you need
depression.
Depression now when person not be himself anymore. You know, you not be himself anymore. It is think about other things, bad things, this and that. You know, so we want make sure say that person feel live a normal life as much as if he can if it. So we bring nursing team, we bring the psychiatrists, we bring nutrition. You know, for keep this person at least healthy. You know, something they call palliative care. If not person way.
What do you mean palliative care, Doctor?
Palliative care na care where you give person way maybe you not get long time for live. You know, and then you just do palliative care. You give you pain medication. You treat his symptoms. Make sure say he live for the time being healthy. You know, so all those things then they come into play for. Do the holistic part of the treatment after you don't do the conventional part.
Okay, great. So like Dr. Doctor, cancer is a serious thing, right? Where if it lead to somebody become depressed, it means your mood just changed. You just want to be you down. You think say life no worth it. You just life they can't end. So every time you just there for bed, you don't even want job, you don't want to see your friend them, you don't want to talk to anybody because you believe or you think say the fact say they don't give you diagnosis of cancer means say
death sentence.
Death sentence. So now way it said they go bring those behavioral therapies and counseling them.
Correct.
Where allopathic or conventional medicine need the Adam for day. Or where they just do not say, okay, come either we give you radiation or we'll give you some medicine them or all those concoctions for treat the person.
Mostly medication, yeah.
Mostly medication. But for a practice, they add all of those behavioral things. I see all those physical, mind, body counseling and feedback and stress and some interesting one day where I see where they like say they like when I go inside they pray for the two in a church.
Yeah, you know, you deal with the person is soul, spirituality, you know,
spiritual.
Meditation, you know, yoga, you know, all those things and way if you help the patient.
Okay, yes. So good. Because when I don't see all this spiritual and all of those things, you know, me say Dr. Donaldson Pastor now, it's just another way to introduce all those people them. You know me say now you do all those things.
No, of course not.
Okay, good. So I just want to let my people understand, say the fact say they do kind of an integrative approach. It means say other people they will take these different aspects and for the thing, this energy and this, they put them inside the one situation for fix the person. This big problem whether they talk cancer. If we fix them, if we prevent them, and if we prevent them, what we will do?
Very good question. Now, things the way they cause cancer externally and internally. Internally, na things that you feel inherit them, they call them genetic, you know, like picking where mommy get breast cancer and all those things, those genes, they feel be transmitted to the...
If you fix that gene them?
Gene therapy for that one, all those things and things the way it in the works, but it be very rare. Okay. So, but then the external factors where they cause cancer, things that we will handle them very well.
We'll talk about those.
Smoking, for example, where they cause lung cancer, bladder cancer, a lot of different cancer them. So if you stop smoking, then so those are risk factor than that. Okay, drinking will cause cancer of the throat. That is excessive drinking. Okay, it will cause cancer of the throat, of your mouth, larynx. That's your voice box and all that. So, and then other external factors: radiation, light, sun. So people, the way they go inside sauna, or they go be, mostly for white skin, them where they absorb all the sun. If it's cause skin cancer, So now some few examples in that for things then where they be external, where they cause cancer. So if you avoid those things, then your risk of getting cancer to reduce. Another thing very important, the diet. Diet for this time now. They put a lot of preservatives.
We go come for that one, the preservatives.
Okay.
Because you just talked something a bit interesting, right? Mm-hmm. You talk risk factor and you talk cause. Mm-hmm. Now the same?
Risk factor, now, if it be interchangeable, okay, but not be the same.
Okay.
Yes, not be the same.
All right.
The cause, for example, for tobacco, where you risk factors, tobacco, okay, the thing where they inside that tobacco where they cause the cancer, nicotine.
Okay.
Okay. So those ones are we get small difference for that. Mm-hmm.
Okay. So the risk factor, you be something to put you at risk for something, not necessarily means it will cause the thing. Because you have instances where people they smoke for 1 million years.
Correct.
They need to get them. For medicine, if you say something to cause the thing, a one-to-one relationship. It means each time you be exposed to the thing,
it will happen.
It happen. But we know say people they do where they smoke. They don't smoke self past chimney, they need to get them. So that one now we talk say risk factor. Yes, the fact says something at risk, and for a fact say it not necessarily cause. It not mean somehow you expose yourself for the risk.
Correct.
Because we hope say sometime now we could be the person where it not cause the thing.
Get them.
But the hope not be a strategy for fix your problem.
Absolutely not.
You don't talk about smoke. You don't talk.
I say nutrition.
You don't talk about nutrition.
Poor eating.
No, I want because that one a big topic.
Yes.
I want we will take some time, right?
Yes.
Study this conversation because it's a big one. All these things and we talk about smoke, lifestyle, way to breathe, sun, how we feel prevent ourselves. Now a long list of things them. But the interesting thing we have one made Dr. Doe, I need to explain that for now. I say, yes, one a risk factor, then one a cause. The risk factor them eventually they feel cause or maybe they not feel cause. But it could be a good thing for we for try all we possibly can for avoid those risk factors. And it no mean say the flip side, it no mean say if you avoid the risk factor, you go to get the thing. People they never ever smoke.
Correct.
They get cancer.
Yes. Right. A minority.
Yes.
Yes.
But when they say the association means it be higher. The chances for you where you smoke, it be higher than the general population where they smoke.
Correct.
But no say the general population when they smoke no go get cancer.
Yes.
So sometimes the big people that they come for clinic they don't diagnose with lung cancer. They say, but I never ever smoke. Yeah.
Yes.
Okay. So
yes.
I just want me
correct. That's true. Yeah. But they never ever smoke. But other causes them besides cigarette or tobacco cause lung cancer. Okay. So we get air, we get environmental factors. Them. For a typical example now, like asbestos. People the way they don't work for shipyard and all those things. Them where they don't wear masks, they inhale all those things. Them. And that one then things the way they go inside their lungs, it cause that kind of cancer.
It's glioma. Yes. So we don't come for the end of today's show, but before we leave, I want me Dr. Do tell one where people they feel richy, how and when. Dr. Do.
Yes.
Share with people.
Okay, my clinic there for Laurel. The name now. Fidelity Health and Wellness Center. And the phone number then 240-264-6846. The website now fidelityhealthandwellness@gmail.com. We there for Instagram, we there for TikTok, and the other social media platforms.
Okay. So you don't say how they reach you. Maybe say when. So they feel reach you 24/7. If someone wake up now, if they just come up for heaven, they call you, go answer your phone.
Well, if they call the phone number where I give, they feel leave message.
Okay. All right, so
they feel leave message. I go make sure say I reach back to them.
So I just want to make sure.
Yes,
because
absolutely.
with people, these people, they listen carefully and are very astute and very clever people. Them
Correct.
So we don't talk about blood and cancer things today, and it is an important thing for add this integrative approach, especially when you deal with people that get cancer, knowing how serious that diagnosis be. If you forgive yourself an opportunity for deal with the issue holistically.
Really?
We're glad so we'll get some physicians, some doctor inside house, where not be only the holistic person, because there's no true definition of place people that go study for being holistic provider. This is an allopathic physician where he get training for internal medicine, then is subspecialized again for both blood and cancer treatment. So when I don't get all of those things, and they go scroll for the bottom for on a screen, the address, the telephone number, how on a feel reach the day on 24/7. No mind that you will say phone.
Okay.
Say hello to people then.
Well, Afrojamsnetwork, now we networked, and a place where we can get information from we own people, for this language where we talk, for this pidgin language where we talk, so that people doing where they not go white man school or where they not learn white man school, they feel understand all the things and where we talk. And I'm glad for being here. I hope so we'll continue this conversation on other topics.
When I'm here for the cancer doctor, more peace yourself. We'll go see you next time.